Good afternoon, everybody. Thank you for joining us today. We are very happy to be here with Mary Center and Briya. We are here to talk about the new COVID vaccine for children from 5 to 11 years old. This is a very exciting and important topic that we are going to be discussing. My name is Diana Delgado. I am a former Advanced 2 student from Briya, and I currently am a staff member. And I would like to welcome Dr. Marquez from Mary Center. She is an extraordinary pediatrician, and she is here to answer any questions and doubts that we as a parent might have about this new COVID vaccine.
Hi, everybody. It's an honor for me to be here. I am a pediatrician, being practicing pediatrics more than 23 years. I am a Mary Center pediatrician, and I've been here for 5 years, and a venezolana pediatra. Very proud to be a Washingtonian adopted person. I've been here since 1995.
Great, thank you, doctor. And I am also want to welcome Alma Salado. She is an advanced 2 student at Briya, and she is studying to get her high school diploma. And she is also with her daughter, Mia.
Hi, everyone. My name is Alma, and I'm with Mia. This is my daughter. She's 5. She just turned 5. So I will have a few questions about the COVID vaccine for children and her age range.
Okay. And I also want to introduce my son, Daniel. He's here with me today. He's very proud of himself because he already received the COVID vaccine last week. Right, Daniel? Would you like to say hi?
Hi.
Okay. Daniel, how old are you?
I'm 10.
Great. Thank you for being here and sharing your experience with us. Dr. Marquez, would you like to say something to the community about this new vaccine?
Yes, I'm happy to talk a little bit about the vaccine and why I think it's important and it's very crucial to get everybody as possible vaccinated. I want to remind everybody that this virus has caused a serious infection to the people of this planet, and in this country has killed around 757,000 people, and had affected 47 million infections, of which some are severe, some are mild. But it's not a benign process. It's not a small amount. And in kids, it's also had been affecting children in a way that is too many to count in some sense. Of course, it's less than adults, but still any death in a child is extremely severe. And it has been reported around 150 children dead with the virus. And that's an emergency. That's serious. That's not just, oh, they don't suffer as much. And I want to make sure we emphasize on what it means, the infection to the community, adults and children, in order to consider the vaccine as one of the incredible luxury we have as a tool to prevent infection. I am, as a pediatrician, I'm a big believer on vaccines as preventative measure, and especially for kids. I'm used to vaccinate kids since they're born. We start with the hepatitis B, if you remember, and then we go progressively every 2 months, and then every 3 months, and then every 6 months, and every year. And so professionals in the pediatric field are very used to apply vaccine and talk to the parents about the necessity. I see the vaccines as a tool that is a prevention of infections. It's really for the health of the children, and is really to make a better life of the children. And it has been an incredible tool created by the science and the people of the planet to prevent and eliminate some diseases of the earth that were fatal, that were severe, maybe like this one. I don't know exactly what's going to happen with this virus, but it has been proven very efficient, around 91 to 95% efficiency for the vaccine. So it's really important that we all vaccinate our children. And 5 to 11 started like November 2nd was approved for the children. It's an emergency-based vaccination. And then November 3rd, DC, the District of Columbia, started vaccinating their children. And it is an important consideration, as if children's 5 to 11 gets vaccinated, it will increment around 28 million children that are due for possible vaccinating the COVID vaccine. What am I here is because we think we need to hear your questions, your concern. It's really important to do a dialogue. It's not just me telling you, and then you have the experience of the children here. That is also very important to hear from them, what they experience. And I want to know if there's any question about that you want me to answer for you at this moment.
Yes, I know that Alma, she is a mom and she is with her daughter. Alma, would you like to make a question for Dr. Marquez?
Okay, so my question is, as a mom, how safe is that vaccine? Because I am vaccinated. My husband is vaccinated as well. But I waited until the summer because I had some questions, and those questions I couldn't find a solid answer. And until I was able to speak to my doctor, and she told me, she reassured me that everything was fine, that it was safe. That's when I took it. So now that we have you here, I want to know, how safe is that vaccine before I take my daughter, before I make the appointment to take her to get vaccinated?
Yeah. So that's a very important question, Alma. The vaccine has been studied since the pandemic started. It's a very safe vaccine, and for the children 5 to 11 had demonstrated no severe reaction or serious reaction. Is mainly what they have described. The four main concerns is fatigue, chills, like not necessarily even fever, but chills, fatigue, headache, and local pain where they introduce the needle in the muscle or the skin area, right? These are self-limited. It doesn't last more than 3 days. Is a vaccine that like anything that we take or introduce, like a vaccine, there's a possibility of reaction, like allergic reaction. They have been reported allergic reactions, very small amount for the adults, and that the most severe happen the first 15 minutes. So that's why we ask the parents and the patients to wait 15 minutes in the offices. So if there's any concern about allergies, severe reactions, we can help the person, right? It is a vaccine that I want to highlight again. This is not a vaccine that have been developed with cutting steps of science. No, this vaccine knowledge has been accumulating for years, more than 20 years ago. And I want to highlight that we had an epidemic similar to this, but it didn't transform into a global problem. It was in early 2000s in Asia, and it stayed in Asia. It's called the SARS-1, and this one is the SARS-2. So syndrome is an acute respiratory syndrome, severe, caused by a COVID-1. And then we had another type of COVID infection that was in 2011 called MERS. And I'm sure people have heard about it in the Arabic country, peninsulas area. And it's still some cases there. That hasn't been turned off completely, okay? But it hasn't spread to the continents, to other continents. So that process helped us to figure it out, what was the weakest point of the virus. And that's called protein S. It's the spike protein, the little peak like that. And that peak allows the virus to attach to the cells. And one of the things is, then when they realize that's the weak piece of the virus, or the heart of the virus, it's not a heart because they don't have heart, okay? But I mean the really possibly target. That wasn't discovered in 2020. They knew this already because of these epidemics. The mRNA process has been studied more than 20 years again. And in 2007, they manipulated the mRNA in a way that produces a small amount of inflammation. And this team was in the University of Pennsylvania. So it has been there for a while, is not a new knowledge. And I want to make sure I emphasize this, because when this urgency, because it's an urgency, you don't want children dying with it, you don't want any more loved people dying with this. I mentioned before that that I had one of my best friends from medical school was hospitalized for 10 days with COVID. So, we really cannot take for granted this problem, and we want to have a better life soon. So I see the vaccine the same way. For the kids, we want to make sure that we live healthy life when we're adults, and we prevent. So that's why we pediatricians talk about protecting the heart, protecting the brain, protecting the veins and the arteries, with nutrition, exercising, all the things, and then including the vaccines that we apply to the kids since they are born. So I normally see this as a very I study a lot about the vaccine.
I am very happy that Alma brought up this question because I would like to share my experience. I have 3 children, and my youngest daughter, she has a very high risk condition. And we were like, my husband and I, we were thinking about this. And as soon as we heard that the vaccine was approved for younger children, we decided to call her doctor. And the first thing that they told us was she will be more protected, she will be more safe if she gets the vaccine. So as soon as I could, I just took the 3 of them to get vaccinated. So, and this is, I guess, one of the best decisions that I have made to protect my children. And I have here a question that says, what medical conditions might impact getting the vaccine? Might be impacted, I guess.
So yeah, I'm not sure I understand this question very well, but I will say that medical conditions, if you have a medical condition that is high risk for severe infection, it will be important to really consider the vaccine as soon as possible. And in adults, we know that there are some conditions like diabetes, high blood pressure, lifestyle sometimes issues, and asthma are conditions that can, if you get the infection, it can trigger a severe disease. So it's important for the kids that have asthma, for example, to get the flu vaccine and to get the COVID vaccine as well. I have seen children that had asthma and had kind of a very hospitalization with the COVID infection. So I do recommend that if you have a chronic condition that may exacerbate the process, please consider the vaccine. And if you have questions or fears or concerns, please ask the questions to the people who you trust and target it as possible. The reports that have been showing, they have not shown severe reaction to the vaccine for kids 5 to 11. Again, the most common side effects we mentioned here, but anything that we take or we apply can cause allergies. So that's something that we have the precaution. It has been described in adults. All boys have also some reactions if you are older than 12. That is called myocarditis, and is cell-limited. Hasn't been reported in the studies that they did 5 to 11, but and we have to, and we already know how to treat and everything. So I'm not sure exactly if you have more questions about this specifically.
Mia, would you like to say if you are motivated to receive your COVID vaccine? Are you happy to get it?
Are you happy you're going to get vaccinated?
Yes.
You're going to get it?
After my vaccine, I eat some ice cream.
After her vaccine, some ice cream.
That is a very good reward.
What you were talking and explaining how safe the vaccine is, I realized that most of the symptoms that you're mentioning are the symptoms that most kids get, or some kids get, with the flu vaccine. So I'm like, I'm not that scared anymore, because I kept getting nervous about what the side effects, and like, is it really safe? But then when I started listening to you explain the side effects, the sore arm and like a little fever, that's what they usually get when they get the flu vaccine,
Yeah.
and it doesn't last. So I feel a little more calm.
Yeah, and it's something similar. We normally tell the parents that may need to give Tylenol for 3 days. It doesn't last more than 3 days. Any side effect with any vaccine, flu, or anyone, HPV, anyone can cause some more than others. You're right. But it is self-limited. If you have pain, you take Tylenol. You can put local compresses of cold compresses, so it relaxes the musculature. But that's a very good conclusion, Alma. I appreciated that you highlighted that.
Yeah, and I would like to ask Daniel. Daniel, how did you feel after receiving your vaccine?
Um, I after I got my COVID vaccine, I felt normal, but after about an hour or two, I started to feel pain in my arm,
Mhm.
and then it kept going on for like 2 or 3 more days.
Okay. And what else? Did you feel anything else? No? That was all? Okay. Yeah, the three of them, they didn't have that strong side effect, only the sore arm. And my youngest daughter, she, at the other day after school, she was complaining a little bit of headache, but she was totally fine. She was playing as always and eating as always. So it wasn't a big deal, the side effect. So yeah, they were, I have to say, they were very happy, very proud of themselves. Daniel couldn't wait to share to your friends, Daniel, right? Um, do you know if any other friend from your school have received the COVID vaccine?
Yes, a couple students from my class.
About how many?
Like about 7.
7 more students? That's great. That's a good
Mhm.
number. Yeah.
Yeah,
Alma, do you
wonderful.
have another question for Dr. Marquez?
I keep hearing the one of the reasons why they don't get vaccinated is because of religion purposes, or because that's number one, and then the other one, they don't know if it's safe. So some churches, I've noticed that some churches, when I go out to Maryland, to our churches in Maryland, themselves are starting to set up booths to get the booster vaccines and the COVID vaccine for the babies. My question is, how can we maybe ease into like sharing this information to people who might be a little bit more scared in that sense? Like, what information is it like strong enough for us to share and say like, oh, the doctor mentioned this, so we can share with them too.
So Alma, yes, it is a very safe vaccine, and if the question about religious belief is valid, but that has to be determined, right? So they have committees that determine is this a real reason or not. Sometimes you can get patients that have all the vaccines, and they think that religiously they cannot get the COVID vaccine, right? And that's something that you have to address. And that comes again to ask the question: what is the concern? Why are you reluctant? What is, maybe fear can be there, right? What are you concerned? What did you heard about? There is a lot of misinformation going every minute of our life, that some of them we receive, and sometimes we don't have the knowledge, scientific knowledge, or the knowledge to discriminate, okay, this is real or not. So if there's any concern, but it can be causing fear, and that's okay. So it's really first, okay, what is causing me this fear? And then talk to the people you trust, like you have mentioned, talk to your provider. And we Diana mentioned that, talk to her pediatrician. So we need to talk to people who we trust, that knows about this vaccine so we can make sure that we clarify and we give the correct information in the right time.
Great. So right now we have another question from Lucia. She wants to know if you can get the vaccine when you have a cough or a cold.
So that's a very good question. Normally, if you have a cold, we don't normally vaccinate if you have high fevers. If it is a mild thing, you don't think it's going to be anything major cold or anything like that, then we usually recommend, we usually vaccinate. Like for the flu, we usually vaccinate. So the same criteria we use for any vaccine, we will apply to you. If you have coughing and you don't feel well, we don't recommend any vaccine. You should postpone it because we don't know how much you're going to create the immunity that we studied. Because remember, we did the studies in people that were healthy. So we want to make sure we warranty around the specifications we told you. This vaccine will protect you 91%. And those studies were, and those probabilities were assessed in people that were healthy, not people that were having colds. So, and that means that you have another virus, you're fighting another virus. So, you know, when you're fighting another virus and we try to make you produce some fight against the protein S with the vaccine, it's really, I will say that if you're really serious about having a cold, just postpone it and then you come back in 2 weeks when you're feeling better and then you have the immunity. Eat well, drink a lot of fluid, take care, drink honey, whatever your parents want to give you for the virus. But if you're sick, no recommending to get the vaccine at that time. You can wait a few days.
Alma, would you like to make another question? Yeah.
We need an appointment to take our children to Mary centers to get the vaccines, or is it just?
So yes, if you are going to the clinics, you do need an appointment. And from 9 to 12, we recommend to get an appointment, but we are also taking walk-ins. We have few, yes. And we're like, we started last Saturday and we finished all of them. Okay. We had no one waste of those. We did 100 vaccines from
Great.
9 to 12.
Awesome.
Yeah.
I have here Daniel, who has a question for the doctor.
Do you know if they're studying on sick people?
That's a good question, Daniel. They have studied people who had chronic diseases like asthma, diabetes, hypertension, but they haven't done it in kids or people who has acute illness like a cold, right? Sometimes a cold can be a little scratchy throat and that's it. Don't worry about it. It could be other things, right? But if it is a real cold, like, you know, runny nose and you're coughing and you're not sleeping well, you have headaches, then you have a virus that is acute. We don't recommend to do the vaccine at that time. Okay. We know, and if you have high fever, we don't do it with any vaccine either.
Okay. I have heard people saying that why I will get the vaccine if I can also get sick. I can also get the virus. So what is the purpose? What is the, you know, the thing of getting the vaccine? So what would you say to those people that say, you know, I really don't need it because if I get it, I also can get sick. So what you will say to those people that think have, you know?
Yeah, that's a really good question. So the vaccine doesn't kill people. The disease, the infection kills people. I already mentioned in around 5 million people dead in the earth, not in the planet, not necessarily just in the US. The US is only like around 760,000, right? So it's a fatal disease. The vaccine, no. The vaccine doesn't kill people. The vaccine has some side effects. Yes, so up until now, everything is self-limited. The vaccine doesn't have a virus, doesn't cause infection. It doesn't affect the genes. It doesn't affect the cells. It doesn't affect anything internal that will be a concern. And there's a lot of misinformation there. That's why I'm here to see if you have questions. And there's no question that I consider in my life that is lower than others. Any question is priceless, and because it tells me you're learning, and that's what I tell my kids. If you don't ask questions, I don't understand how much you're understanding this. So I want questions, and this is something that I encourage everybody, every patient, to keep asking questions if you have concerns and you have any idea that could be a decision making for you, important for your decision making.
Okay, that's awesome. So one last question, Alma. Do you have one last question, or yes?
Is it only one dose? Because I know we adults got two. Well, I got Moderna, and I got two, and now I'm waiting for my booster. Is it only one, or is it two as well?
It's two. It's two, like Pfizer is two, as well as Moderna. The only one that was one is Johnson & Johnson, but it's not approved for kids. So the Pfizer is 21 days apart, and it is a lower dose than the kids older than 12. So it's a third of the dose. So what they did in the trials, yes, they knew that it was a very powerful tool, very efficient to fight the virus, but also they want to know which is the minimum dose we need to give kids 5 to 11 that will still protect them the same way, above 90%. So they managed to reduce the dose to 1/3, about the dose that we give to older kids and adults.
Okay, that's awesome. And before finishing, Mia, would you like to say something?
You want to say something?
I
Are you happy? So Daniel, before we finish, would you like to say something?
Mia, what did you say?
I don't know.
You don't know.
Okay.
Okay.
So, and what about you, Daniel? Would you like to say something for those kids that haven't received the vaccine yet?
So I think it's a good idea to put on the vaccine, even though you get pain and side effects. It's still good to have, even though you'll get it, even though you still can get the COVID. But it'll protect you more, and you'll protect your family members.
Yeah, that's true.
That's a great answer. I'm so happy to hear this, Daniel. I didn't talk much about that. That's awesome. That's really, you clarified it all.
Yeah,
Yes. And he's right. If you have one person extra in the house, you're protecting your family 60%. But if you have 3 to 4, it's above 90%. You're protecting others that cannot get the vaccine, like younger kids, right? Those kids are not allowed to get the vaccine so far up to date. So we need to make sure that we keep that message in our mind. That's so wonderful, Daniel.
Yeah, and I also want to encourage everyone that the holidays are around the corner, and if you want to keep your family safe and more protected, just consider to get the vaccine for yourself and also for your children, so you can enjoy without any fear the holidays. So thank you everybody for joining us today. I just want to say reinforce, just remember to all of you that Mary Center, they are offering the vaccine for children from 5 to 11 years old. You can go on Saturdays without any appointment. To the address is 100 Gallatin Street Northeast. Is very close to Fort Totten Metro Station. Or yeah, you can also call Mary Center to receive an appointment and to get the shot. Also, if you want to study English, or you are considering, grow on your career and you want to study a medical associate or child development associate program, you can call us at Briya at 202-232-7777, or you can visit our website. It's www.briya.org. So yeah, you just can seize the moment and study with us. So thank you, Dr. Marquez. Thank you, Alma, for this very helpful presentation and conversation. And thank you for being here. Thank you for your time. Thank you for the audience, for your question. We're very helpful for others that are also watching. And yeah, so stay tuned for the next one. Have a good one. Have a good evening.
You too.
Bye.